Bismillah ar-Rahman ar-Rahim. In the name of Allah, the most beneficent, the most merciful. Assalam-O Alaikum, dear viewers. God bless you all. Here is the title of my presentation: Recent Technological Advances in the Management of Diabetes. I am Dr. Abdul Malik, Assistant Professor Pharmacology, College of Pharmacy, University of Sargodha, Pakistan. Here is the list of contents. I shall cover all the contents: life expectancy, diabetes mellitus, hypoglycemic shock, insulin discovery, choice and need of insulin, insulin injections, in glucose pens, continuous glucose monitors, bionic pancreas, inhaled insulin, artificial intelligence. So here is the recent advances in technology for diabetes regarding development and education for the technologies such as glucose monitoring devices and software, insulin and other delivery system devices, healthcare and self-management education, other related advances for diabetes and its complication including retinopathy, circadian rhythms and ViaCyte. How life expectancy has increased? Why life expectancy has increased due to food production, good food production and distribution, improvement in public health, water and sanitization, and third one is medical technologies including vaccines and antibiotics. US life expectancy at birth has risen from 47 years at the turn of 20th century to 78 years today. The insulin pump, an innovative technology for diabetes patients, improves management of the disease. Edward Menio started for his son. So these are the researchers which has started due to their son or any issue. Here is the diabetes mellitus. Diabetes mellitus or DM is a chronic endocrine disorder, aging disorder, which is characterized by hyperglycemia due to either insulin deficiency or insulin actions or maybe both. Type 1 diabetes including absolute insulin deficiency due to autoimmune or due to viruses, mainly in children or early age groups. Type 2 diabetes or type 3C diabetes mellitus, insulin resistance or liver and receptor problems may be there, mainly in adult or old age. Another one that is pre-diabetes, mainly people are nearly to meet diabetes criteria. So gestational diabetes during gestational phase in pregnancy, certain other types are also there like Moody, LADA and etc. Here is the islet of Langerhans of pancreas. This is dual gland having two activities, exocrine and endocrine. 97% is exocrine activity due to acinar cells present here, and pancreas, you can see the tail of the pancreas, body of the pancreas, head of the pancreas, and in islet of the Langerhans is here. One islet of Langerhans has been shown. Alpha cells having glucagon and beta cells having insulin that produces insulin, and some delta cells and F cells are also present. So prevalence of diabetes according to IDF, International Diabetes Federation, diabetes currently affects 7% of the world's population, nearly 250 million individuals worldwide. More than this population live with prediabetes due to lack of diagnosis or will develop soon. The prevalence is expected to rise to 380 million by 2025 as a result of aging populations, changing lifestyles, and recent worldwide increase in obesity or overweight. In Pakistan, the prevalence is 35.3 million adults that have diabetes. That survey has been taken in international the news 2017. Here, how can we diagnose or what are the causative agents and what are the complications of the diabetes? Diagnosis include fasting blood glucose levels, postprandial blood glucose levels, oral glucose tolerance test OGTT, HbA1c, urine test can be done, and you can diagnose pre-diabetes that ranges from less than 125 milligram per deciliter glucose level, and lifestyle and including diet and supplements. If there is a less you are taking, then that can cause the problem. Genetic factor, if a family member have diabetes, then there is a chance of the children that can get the diabetes. Urbanization, that is from rural areas to in big cities where sleep and other problems and stress is there, urbanization also causes diabetes. So obesity is one of the major factor. Physical exercise, if there is a non-physical activity, then that can cause the diabetes. Smoking is also risk factor. Health awareness should be taken. Sunlight, circadian rhythm is also important. Medication that also causes diabetes. Pregnancy that causes gestational diabetes. Monitoring of the blood glucose essential for these one. Now causative agents, after that we go towards the complications. Chip is being made for diagnosis to differentiate between type 1 and type 2 diabetes containing autoantibodies. Complications include macrovascular complication including retinopathy, nephropathy, neuropathy, and macrovascular complication including coronary artery disease, stroke, atherosclerosis, or foot amputation. Here is one emergency shown in the Southern California hypoglycemic emergency, that paramedics in Southern California attend a diabetic man who lost effective control of his vehicle due to hypoglycemia but required emergency intravenous glucose. Due to this problem, we are doing some new technologies that can help these patients to save their lives. Now we see on the next page, targeted therapy of diabetes type 1 and type 2. Frederick Banting, orthopedic surgeon, was that in Canada, and Charlie's Best, another one person. They have done the practical or experiment on the dogs. Insulin isolated in 1921, administered to patient in 1922. Nobel Prize was given 1923. Mass production of by company Eli Lilly in 1923 for type 2 diabetes. Oral hypoglycemic agents or insulin can also be helpful. Types of insulin. How can we divide the classify the insulins? Non-analog biosynthetic human insulin sold as Humulin N or Humulin R, Novolin N or Novolin R, N mean NPH and R mean regular insulin. Commonly used analogs including long-acting glargine, Ditimer, fast-acting glucose, Lespro, Aspart, and glulicine. Newer insulin preparations, U500 vial or pen form, U300 glargine sold as Toujeo, U200 Lespro, D-gludic extra long acting sold as Tresiba, available as unit 100 or unit 200. Inhaled insulin that is sold as Afrezza. Pre-mixed long-acting short-acting insulin having doses 50 to 75, 25 to 50 are also seen. Now we go towards the insulin dosing in the type 1 diabetes. How we will give the dose to the patient that have type 1 diabetes. Weight-based insulin is given. Start with roughly 0.4 to 0.5 units per kg. More important to monitor carefully and adjust. New onset diabetes commonly associated with residual insulin, so initial needs to may be small compared to eventual requirements. Typical adult with established type 1 diabetes needs about 40 to 50 units total insulin daily. Needs may vary greatly with activity, eating patterns. Overweight or obese type 1 diabetes may require much larger dosing. So here is two major types of insulins, that is basal insulin, that may be bolus, that can be given on the after meal or before meal. So MDI or pumps are available. Approximate one half of the total dose should be given as a basal insulin should be given either as once or twice per day long acting insulin glargine or Ditimer, or a twice per day intermediate acting insulin NPH can be given. So these are the basal insulin. Now glargine or Ditimer can be given either at bedtime or in the morning. Two major times are there, may need to change to BID or can be changed to 2 times. Bolus insulin, that is given as a short or rapid acting insulin divided before meals, that is given for meal. That is basal insulin, that is for the deficiency of insulin, absolute deficiency of insulin to concentrate the basal level. The pre-meal dosing is determined by the pre-meal glucose level, meal size and content, as well as activity and exercise pattern. Route of administration of the insulin may be subcutaneous, intradermal or intravenous. Here is management of diabetes. Diabetes is lifelong and often disabling disease that impact the quality of life. The various lines of research may be include followings: pharmacological approaches, biological methods and technological advances for diabetes and its complications. Following companies are working: Dexcom, Medtronic, Abbott, Tandem, Google, Insulet, Omnipod, IBM, Roche, Novo Nordisk, Eli Lilly, Novo, Sanofi, Bigfoot and Soil, etc. These companies are working. Choice and need of the insulin, that is based on the patient and the technology. And you can see the previous one is syringes are available, and next is pens are also available and pumps are also available. This is your choice how you will select. New versus old diabetic blood sugar devices, that is new one that tell the units. You can see units are here, 7 units, and pen also showing the 7 units last dose was given. So on the other hand, previous Lancet method is there. You can take the glucometer and check this one. Nasal glucose Locemia is a nasal spray that allows diabetics to inhale a powder glucagon via through their nasal passages in order to boost blood sugar levels in emergencies. This is a new thing, that is nasal glucose available Locemia. Trade name is there, that provide an emergency sugar level to boost the sugar level. To use, one simply inserts the vial into the nostril, pushes a button and inhales a puff of the powder. It works within a few minutes. This is very simple one. New glucagon formulation for hypoglycemic patient, that is glucagon pre-filled syringes are available that can be given to the patients. So another one we see continuous glucose monitoring, CGM sensor, in which following things work. Sensor monitors glucose level in the interstitial fluid. The sensor stays in place for several days and weeks and then must be replaced. So sometimes it can be used, but not several days. After several days should be removed or replaced. Calibration required with glucose glucose meter to program the devices. Glucose levels should be confirmed with capillary test before making a change in the treatment. Alarms can be programmed to alert when glucose levels are too low or too high. This can be set with the alarms if there is a low glucose or high. Freestyle Libre Pro continuous monitor for 2 weeks, 14 days. Bluetooth technology is there for medical professional use. The Abbott Freestyle Libre Pro continuous monitor approved by FDA. This glucose sensor is placed on the patient by a healthcare professional and is used for 14 days to collect blood glucose data throughout the day and night. There is no need to calibrate the sensor. At the end of the 2 weeks, the healthcare provider downloads the information and can look at trends and other information to make customized adjustments to the medication regime. This is a new thing. While Freestyle Libre can be used for self-management, a patient version is under review. This is the Abbott Freestyle Libre that has been attached in the arm and can be checked with the blue cone freestyle auto assist and labor link. You can see with the help of. Next we go towards the Google Lens for blood glucose monitoring in tears. Google and Alcon companies are creating contact lens. This is new technology that measures the glucose in tears. A super small sensor and thinner than hair antenna will be embedded between two soft contacts. A small hole in the lens will let tears reach the sensor, which will determine the glucose value once per second. That data will be wirelessly transferred to mobile device or monitoring. So temsolene insulin pen tells time or last dose of the insulin that has been given. These are already I have shown in previous slide. For people living with type 1 diabetes or some people with type 2 diabetes, injecting insulin is a necessary part of the life. Some choose to get insulin through the pump, but others inject either from a vial using a pen. So diabetic needle-free insujet system, separate in healthcare pharma is preparing this needle-free insujet, that is free insulin, but can release insulin in the skin without needle. Life scans, one touch, bolus dose for bolus dose only. This is given for meal time only. This wearable on-demand delivery system allows people with type 1 or type 2 diabetes to deliver mealtime insulin dosages anytime, anywhere. Contains 200 units of fast-acting insulin, may be worn for 3 days at a time. This is very new technology. Using application, find data to promote health lifestyle. This is another thing. Some applications in the Android or iPhone are found which are helpful in monitoring, controlling the obesity, diabetes. Healthy eating and physical activity should be maintained. Achieving and maintaining a healthy body weight. Some apps for phone, Foodocat, that educate about the food, how food should be taken. iPhone and Android free software are available. Diabetes and diet tracker apps for iPhone, etc. MyFitnessPal app, which determines calories in food items and also scan that. My sugar logbook, EcoCheck, diabetes logbook apps are available on iPhone and Android phone by Roche. Some gadgets like pedometers that measures about the foot, bath thermometers check the temperature for neuropathy, inspection mirror for the foot care is also an essential one. These gadgets are also available. Telehealth remotely control the patients through text, video and alerts that control the patient to take the dose or any care for that patient. Hidden needles technology has developed a pill with hollow needles at left that can inject the drug directly into the stomach lining once the capsule has been swallowed and its outer coating dissolved. The approach is still in its infancy, but it could provide another way to deliver insulin. Exenatide implant, that is GLP-1 agonist, liraglutide or exenatide for type 2 diabetes. Intarsia is a matchstick-sized device implanted under the skin that delivers a continuous dose of the type 2 diabetes medication, exenatide GLP-1 agonist. While exenatide is traditionally delivered via twice a day or once weekly injections, the ICTA 650 would need to be implanted only once or twice a year. So this is big chance for the diabetics to use exenatide implant. Artificial intelligence AI for diabetes. As in type 1 diabetes, there is absolutely deficiency of insulin in children and adults. It is helpful in following areas. Diagnosing device can be used, monitoring devices can be used, delivery of the insulin devices, its complication can be checked with the AI, artificial intelligence. Retinopathy, nephropathy, neuropathy, diabetic foot problems, cardiovascular problem and medical robotics can be used for surgery or other purposes. Medtronic MiniMed 670G Artificial pancreas. Minimed 670G is FDA approved for people with type 1 diabetes ages 14 and over. This is used only for ages 14 and over people through a pediatric study. 7 to 13 years old is currently underway to investigate the expansion. It's an expansion in how it can be prescribed. See figure on the next page. The device cannot be used in children less than 7 years old, and those are less than 8 units of insulin per day if required. Minimed 690G is also on clinical trial. Artificial pancreas Medtronic Minimed 670G is shown here in this. How glucose sensor is attached, transmitter is attached, and the whole Medtronic Minimed is shown on the left side. T-Slim X2 insulin pump. Tandem T-Slim X2 insulin delivery system pump with Bluetooth radio and enable software updated to add Dexcom G5 connectivity and automated insulin delivery algorithms. This is new coming pump. Dexcom G4 Animas Vibe insulin pump and CGM system is there that can release the continuous glucose monitoring. Johnson & Johnson company also approved for children as 2 years. Company will work with Medtronic as a partner of choice to help ensure a smooth transition for patient on insulin pumps. This is a new thing. Assalam-O insulin pump key features include can be worn as either a patch pump or tethered pump, wirelessly touch screen remote handset act as a blood glucose monitor on board food database application, bolus calculator, activity monitor on the pump. Data can be wirelessly exported to computer, laptop or tablet. Rechargeable battery is there. So you can see the figure here. This is the major Assalam-O UK insulin pump. Major 3 function is there. 3 parts are there: insulin pump, small and smart, and other you can see online attachments is there. This is easily attached. Bigfoot plus Abbott and Soil company Dana pump. Bigfoot Abbott company is also making the pump, insulin pump, and Soil company pump is also shown here. You can see an Abbott and Soil pump. Halozymes Halinex for faster absorption of insulin. Halozymes Halinex is a promising solution for speeding up the action of the rapid onset insulin. This is for rapid action insulin for emergency situation. Halozymes contain hyaluronidase enzyme, which accelerates insulin action for approximately 3 days by losing the tissue below the skin, thus permitting faster absorption of into the bloodstream. Infusing or injecting hyaluronidase into the skin prior to inserting a pump infusion set produces much more rapid bolus action, with insulin peaking approximately 30 minutes earlier. This could be a very valuable tool for combating post-meal blood glucose spikes and rapid correction of the hyperglycemia. This is very new one. Artificial pancreas, bionic endocrine pancreas, insulin Lespro and glucagon were administered under closed loop control using control algorithms. The only input signal was data from the Freestyle Navigator, Abbott Diabetes Care, and interstitial fluid CGM approved by FDA. It provides insulin and glucagon at a time. Bihormonal hormone is this one. It has the 2 separate pumps. Russell et al. 2012 Diabetes Care. This is journal that has published. Bihormonal artificial pancreas, 2 major types: beta bionic, having both glucagon and insulin. Bihormonal mean 2 hormones, insulin and glucagon. Older version was that, but new version has come now. Now clinical trial using Freestyle Navigator and Omnipod patch pump is also shown. That also works like pump, like we have studied. This is Navigator, Freestyle Navigator. Now admit cis For hospital for blood glucose control, this Johnson & Johnson company has revolutionized diabetic treatment. First fully automated hospital blood glucose control system is there that can easily get the results, all the things. DiabNext develops a next generation diabetic artificial intelligence. DiabNext Calypsolin is 2017 Consumer Electronics Show Innovation Award winner. Calypsolin is a part of DiabNext, the world's first artificial intelligence tools dedicated to diabetes management that integrates a suite of interactive softwares and connected hardwares. Calypsolin is a smart connected insulin dose recorder, designated to be compatible with insulin pens used around the world. It automatically captures the number of units injected as well as the date and the time of injection. This metric is then saved and transmitted to the DiabNext AI on a smartphone or computers. DiabNext, you can see how it saves all the data and collects and send to the laptops of computers. Artificial intelligence in diabetic retinopathy. This is complication of the diabetes. Scientists are using artificial intelligence technology to save people's eyesight and make healthcare more accessible for all Australians. Eye screening technology enables GPs to test diabetic patients for diabetic retinopathy, a debilitating condition affecting 1 in 3 diabetic people that can lead to blindness if untreated. Currently, only specialists can screen for the condition, but this software or machine will help the doctors to understand the complication of the retinopathy. Next we go about the circadian regulation of glucose. If there is a misalignment in circadian rhythm, then there may be unregulation of glucose, lipid and energy metabolism in humans. If there is a control like in previous figures, circadian alignment, peripheral or central clocks are equal, then there is a less chance of problems of insulin or diabetes. If there is a misalignment, then there is a problem in sleep and circadian unregulation of the glucose, lipid and energy metabolism happen in the humans. So ViaCyte in Captra drug delivery system for type 1 diabetes stem cell delivery. VC-01 combination product composed of PEC-01 pancreatic endoderm cells. In Captra, microcapsulation encapsulation device placed under the skin further will differentiate into insulin and other pancreatic cells protected from immune cells, potential cure for type 1 diabetes. This is new technology. Here is Edward Damiano Bionic Pancreas with his son and with all the other group that make the Bionic Pancreas, Edward Damiano. Thank you very much for your attention. Please subscribe my channel and like and further message if there is any question. Thank you very much for your attention. God bless.